So in this last section of gastroenterology topic regarding esophageal tumors, we'd be studying about the non-epithelial tumors. These tumors are the tumors that arise other than the epithelial surface. They could arise from the lymph nodes or from different type of vascular malformations or other types of non-epithelial tumors. So in this topic, we'd be studying about the malignant type of non-epithelial tumors such as lymphoma and sarcoma, and the benign different types of non-epithelial tumors such as hemangioma, hematoma, or lipoma. So the first malignant non-epithelial tumor would be lymphoma. Lymphoma could be primary or secondary. It is usually with the involvement of the regional lymph nodes, and it usually presents with less than 1% of all the esophageal malignancies. A patient might present with dysphagia, weight loss, gastrointestinal bleeding, or any sort of esophageal fistula. And the more non-specific systemic symptoms that a patient might present with are fever, night sweats, and fatigue. Endoscopically, if we try to diagnose this patient, we'd see structures such as submucosal nodules or different ulcerations can be seen through the endoscope, such as this part over here and these mucosal surfaces. And this patient might present with either the Hodgkin types of lymphoma or the non-Hodgkin type of lymphoma. Non-Hodgkin type of the most common subtype would be the diffuse large beta cell lymphoma. The second most important malignant non-epithelial tumor is the sarcoma, which is a very rare mesenchymal tumor. The different types of sarcomas could be the leiomyosarcoma or the fibrous sarcoma, which is more of a fibrous form, the Kaposi's sarcoma, choriocarcinoma, and the liposarcoma, which consists of more fat cells. So in the sarcoma, the leiomyosarcoma is the most common type of malignant non-epithelial tumors, and this usually can be intraluminal, or it can be of a polypoid form, or it could be infiltrative or invasive. If you see the leiomyosarcoma histologically, we could see whorls of spindle cells with increased mitosis and marked pleomorphism, as you can see in this histological picture. Other than that, esophageal ultrasound with fine needle aspiration is the most important type of diagnosis, technique of diagnosing leiomyosarcoma, and thus a surgical excision is required. The third most important malignant non-epithelial tumor is the gastrointestinal stromal tumors, which is the most common mesenchymal tumor. It is the most common form, and it consists of only around 1 to 3% of the cases. Patients might present with dysphagia, bleeding from any ulceration, dyspepsia, epigastric pain, or weight loss. In gastrointestinal stromal tumors, the patients usually present with submucosal solitary mass, which is present in the distal 1/3 of the esophagus. Endoscopic ultrasound is the most accurate imaging method to diagnose gastrointestinal stromal tumors. These type of tumors usually express CD117, which is encoded by the gene KIT. This gastrointestinal stromal tumors is usually present in the head and neck region, and it is very rare if it's present in the gastrointestinal tract. But if it is present in the gastrointestinal tract, esophagus is the most common area where gastrointestinal stromal tumors could occur. The surgical treatment of gastrointestinal tumors, the endoscopic submucosal dissection, is the only way to get rid of this tumor. Now, if we study about the benign non-epithelial tumors, there are very different variants of benign non-epithelial tumors. Firstly, being the leiomyoma. As you can see in this picture, this is an X-ray of a patient having leiomyoma, which is in the cervical region of the esophagus. This part over here is the leiomyoma. It is the most common form of the benign non-epithelial tumors. It has a very male predominance. It is twice as common in males rather than females. It has a very submucosal solitary mass, as you can see in this picture. And in the end, endoscopic ultrasound is the diagnostic test for leiomyoma. And large symptomatic lesions, which occurs very rarely, only requires excision for these type of leiomyomas. The other is the granular cell tumor. This is very less common in GIT tract, but if it is common, it is usually present in the esophagus. It is usually 33% of the cases and it's very rare. It has a very solitary submucosal type of a lesion. The color that consists of granular cell tumor is very yellowish. And ultimately, the treatment is always endoscopic resection. And endoscopically, the tumor is being resected, and this is the treatment option available for the patients. So, fibrovascular polyp includes cervical esophagus. This fibrovascular polyp is included in the esophagus that is usually present within the neck, and it consists of a pedunculated polyp, which consists usually of blood vessels. It is usually diagnosed incidentally. Patients usually present with different type of esophageal disorders, and they undergo endoscopy. And incidentally, a fibrovascular polyp is being seen by a gastroenterologist. The patient might present with dysphagia or global sensation if a patient has a large pedunculated polyp, and the treatment modality offered to this sort of patient is the removal, which is either endoscopically or surgically. The endoscopic ultrasound of a larger polyp is very necessary because a very large vessel might be residing within this large polyp, and it is very necessary to undergo an ultrasound before or prior to any incision, because this could have a very drastic sort of a bleeding with a large vessel. The other benign non-epithelial tumor is the lipoma. It is usually 0.4% of all the tumors regarding esophagus, and patients usually present with none of these symptoms such as dysphagia. They're usually asymptomatic. If you see through the endoscope, this might present with very yellowish raised nodules within this esophagus if you see it through an endoscope. There's a pillow sign or an indentation or cushioning with palpation whenever a patient with this esophagus, with this type of tumor, the tumor is being palpated. It has a pillow sign, and this lipoma is treated endoscopically or surgically. This is a CT scan of a patient with lipoma. As you can see, this black structure over here is a lipoma, and this lipoma is present over here on this cross-sectional section of CT scan. The second last most important benign non-epithelial tumor is the hematoma. Hematoma are very rare and very less common, and it is also a pedunculated polyp, as you can see in this picture over here. And these type of patients present with dysphagia, globus sensation, or asphyxiation. Asphyxiation could be fatal. Other than that, this type of hematoma present with multiple tissue types such as bone or cartilage, adipose tissue, and they might also present with smooth muscle or skeletal muscle. Surgical excision is the only treatment option available for hematoma. Other than that, hemangioma, which is a very vascular sort of a malformation, these patients present with gastrointestinal bleeding or dysphagia. There are two types of hemangioma, such as the cavernous and the capillary type. This sort of a submucosal nodule has a blue to red color because it consists of blood vessels. And if we take a biopsy sample, there is a risk of bleeding within this hemangioma, and the treatment option available is the surgical resection. This picture here is of a hemangioma that consists of all the blood vessels also. So in this lecture, we've studied about different type of esophageal tumors. The first, we've studied about the more cancerous, the more malignant type of cancers, such as the esophageal squamous cell carcinoma and the esophageal adenocarcinoma. We've studied about the different type of genetic factors that are involved in producing a more malignant type of this carcinoma. We've studied about different clinical features that a cancerous patient might present with, and then we've studied about different diagnoses and different types of treatment modalities available for cancerous patients, and lastly, we studied about the staging and the prognosis of these patients. In the other section, we've studied about the more malignant and benign type of epithelial tumors and the malignant and benign type of the non-epithelial tumors that are usually due to lymph nodes and different type of blood vessels. That's all from this lecture. Thank you for watching sqadia.com.